All right, back again for part 3. Oh, come on. Okay, so this is gonna be very this will be very different. We're not talking about these usual endocrine disorders. These are ones that are just involved basically with making babies, with getting pregnant, and we're really going to be focusing on the female, um, not so much the male. So these drugs are used for different things. They're used to synchronize estrous cycles. We'll talk about what that means. They can be used um, to induce ovulation for breeding. That's kind of similar to synchronizing cycles. They can be used to prevent pregnancy or to terminate a pregnancy or to induce parturition. That means you want the patient to have the baby tomorrow, so we can do that. And there are some medical problems we can treat too. Now, this is a kind of an odd system. This is not like the thyroid gland or the pancreas. With the reproductive system, things are constantly changing. They're cyclical, and that the drug may be effective or not, or it may be indicated or contraindicated, all depending on what stage we are of the estrous cycle. And so we'll start by giving you an overview of what's happening in the female every cycle. A common source of confusion are these words estrus and estrus. They are pronounced the same, but they don't mean the same thing. Estrus with an O refers to this whole cycle, the cycle of not being in heat, to being in heat, to not being in heat, and then everything in between. And by in heat, well, that refers to this other word, estrus. So estrus means to be in heat, and it refers to the part of the cycle where the female is sexually receptive. So sexually receptive behaviorally and physiologically. And so again, we can kind of start by looking at, here's a dog in estrus. She may be more receptive to the, well, she has to be. She'll be more receptive to a male. If a male tries to mount her, she'll let him. After that, she enters what's called, after that, she enters what's called diestrus. So it's traveling, we're traveling this direction. So now maybe she's pregnant, maybe she's not, but she's not in heat anymore. If a dog tries to mount her, she will not let him. And then in dogs, after that, they go into what's called anestrus, where it may be 6 months and nothing's happening. And then when it's time for her next cycle, maybe I should have started here. She goes into proestrus. She will not let the male mount her, but her vulva is starting to swell. There's some bleeding. She's maybe interested in the male, but if he tries to mount her, she will not have it. And then she's in estrus, and that goes into diestrus. But just remember, because I'm going to be using the word diestrus a lot, so just remember that that comes after estrus. Now, some species never go into anestrus. So cows, sows, humans, they just go from proestrus, estrus, diestrus, proestrus, estrus, diestrus. Other species, they go through the cycle again and again at certain times of the year, like the horse. And then other times of the year, they're in anestrus. But so my point is, we could put in any mammal we wanted to, right? These could all be cats. They could all be horses. They could all be goats. They could all be hamsters, right? They're all going to go through these same cycles. There's some differences about how often they cycle, but when they cycle, it's proestrus, estrus, diestrus. And again, what's going on is we get these different hormones that are either rising or falling, while other hormones are rising and falling. So leading up to estrus itself, again, this just shows you a horse. They have it starting at estrus. Her vulva's winking, her cervix is relaxed, right? She's receptive to a stallion. Then she ovulates, and then now she's not interested. And if he tries to mount her, he's going to get kicked in the head, right? And then diestrus, and now she's going into proestrus again. And this is showing you these different hormones we'll talk about. There's follicle stimulating hormone and luteinizing hormone, so you'll learn about those. Leading up to estrus, the hormone estrogen dominates, right? Right here you see estrogen going up. Here we are in estrus. And it's under the control of the master gland, the pituitary gland, and two of its hormones called follicle stimulating hormone right here. You see it going up, and luteinizing hormone also going up. And then during, and that's just during estrus. And then during estrus, the female will ovulate, and then she'll move into the next stage of the cycle called diestrus right here. And diestrus is where progesterone dominates. So that's the overview. And now we're going to look at it a little more closely. So the first part of the estrus cycle we'll look at is leading up to the female being in heat. And this is called the follicular phase. So here we are, we're looking in the horse's reproductive tract. There's one of her ovaries. Could be the left or the right ovary. It's associated with her uterus. And there's this little blister forming. It's called a follicle. And in the follicle is an egg, also called an oocyte. And there's a hormone we'll talk about called FSH. So the ovary is developing one or more of these follicles. And as the follicle grows, it's eventually going to ovulate. And that means it's going to erupt and propel this little oocyte out at around the time that the female is in heat. And again, this is just showing you, here's an ovary with a little follicle here. And you're going to see that all follicle there, it's ovulated. It just spit out the oocyte. So to understand what leads to her ovulating and being in heat, we have to look at what the pituitary gland is telling the ovary. And also we have to look at what the hypothalamus is telling the pituitary gland. So we'll start with the hypothalamus and the pituitary gland. Like we said, here's the little hypothalamus. There's the pituitary gland. Its job, it communicates to lots of different parts of the body. And I'm not trying to make fun. I have, these are what most of my best friends and cousins look like. So I'm not trying to make fun of anybody here. I just thought this was a good way of describing the process. So we have the hypothalamus is going to give an order to the anterior pituitary gland, and then the anterior pituitary gland is going to give an order to one of the endocrine glands. What's happening is the hypothalamus releases its own hormones, different hormones, and they'll tell the pituitary gland different things. So, for example, to help control the female estrus cycle, hypothalamus releases a hormone called gonadotropin releasing hormone. Now, remember that word gonadotropin releasing hormone because you're going to see that again later. And gonado refers to gonads. Gonads, that's the term for the reproductive organs. So in the female, that would be the ovaries. In the male, that would be the testes. And then tropin, we said it means to have an affinity for. So a gonadotropin releasing hormone means, hey, release those hormones that are gonadotropins, right? Release those hormones that have an affinity for the ovary or the testes. And those hormones are known as follicle stimulating hormone and luteinizing hormone. Those are the actual gonadotropins. Follicle stimulating hormone, like it sounds like, its job is to stimulate the follicle to get bigger and bigger and create more and more estrogen. It does not make the follicle ovulate. It just kind of coaxes the follicle into getting bigger and bigger and making more and more estrogen. Luteinizing hormone, it's going to come in a wave and make the follicle boop, ovulate. Um, it's it's also going to, the word luteinizing um, is a clue because it's also going to turn the follicle into something called the corpus luteum. But hold off on that, just to show you, right? Follicle stimulating hormone from the pituitary gland. Well, first, the hypothalamus is releasing gonadotropin releasing hormone, and that stimulates the pituitary gland to release FSH, and the follicle gets bigger, and there's a little oocyte sitting inside the follicle. It's making estrogen, and this is from a female, a human female, but because we don't use the word menstrual cycle to describe things in veterinary medicine, but we get the surge, a surge in estrogen from the follicle will actually cause a surge in luteinizing hormone, and that causes the spitting out of the oocyte, right? That's the ovulation. Okay, now that's the end. That's the end of estrus. Estrus is now over. Estrogen will no longer dominate because a new hormone is going to come on stage. So what happens is now that follicle is going to make its way down the oviduct into the uterus, and where it may encounter some sperm. But let's follow what happens to that follicle. It changes into this yellow structure called the corpus luteum. Corpus means body, and I want to say luteum means yellow. It doesn't really, but if it helps, let's just pretend that luteum means yellow. So corpus luteum means yellow body. And now, instead of estrogen, it's making a similar, well, it's similar in structure, but it does different things, is progesterone. So now corpus luteum is going to start to make progesterone, and progesterone's job is to prepare for and maintain pregnancy. Okay, progesterone basically means, in favor of gestation, and gestation means pregnancy. So what is progesterone going to do? It's going to make the endometrium, that's the inner lining of the uterus, it's going to make it thicken and secrete a bunch of nutritious fluid. It'll prevent the muscles of the uterus, that's called the myometrium. It'll prevent them from contracting. And so this phase, in which the corpus luteum is in charge, is called the luteal phase. That's as opposed to the follicular phase when the follicle was in charge. And this just goes around and around, because then eventually that corpus luteum will regress, and then a new follicle will emerge. Again, it depends. In the cow or the sow, this just goes, it happens year round. In the dog, this is just going to happen once, and then the dog goes into anestrus for 6 months. Okay, anyway, again, just to review, the follicle makes estrogen, which is the hormone of estrus. If you like, you could call it the hormone of getting pregnant. Corpus luteum produces progesterone, which is the hormone of pregnancy, or if you like, staying pregnant, right? Getting pregnant and staying pregnant. Now, if the female does not get pregnant, then after some period of time, maybe a few days or a week, if she's not pregnant, the uterus sends a message to the ovary to destroy the corpus luteum, or we say it lyses. Lyse means to destroy the corpus luteum. And the message that is sent is a chemical. The chemical is called prostaglandin F2 alpha. And you've learned about prostaglandins before, right? There's the bad prostaglandins of inflammation and the good prostaglandins that help produce stomach mucus. They're local, right? They're like little local hormones. They don't travel all over the body. They just stay local. So this one is kind of, it's one of those sort of prostaglandins, but its little local job is to destroy the corpus luteum. And when that happens, then the next cycle can begin. so that's what happens when the corpus luteum gets destroyed. It can happen again year round, or seasonally in some animals like the mare, or it may be many months later that this process begins again, like in the dog. Okay, now what if she does get pregnant? Well, if she does get pregnant, then the uterus will not send a message. The uterus will not destroy the corpus luteum. Instead, the corpus luteum will persist throughout the pregnancy to produce progesterone. So that could be 9 months in a human or a cow. It could be 11 months in a mare. Like in the elephant, it's like 3 years or something. So, and then at the end of her pregnancy, the fetus actually signals its own birth. At the end of her pregnancy, the pituitary gland of the fetus releases a different tropin hormone. You've already learned it. It's nothing new. It's ACTH. The fetus will release ACTH. That's the adrenocorticotropin hormone, and it'll make the fetus's adrenal gland release cortisol. It'll also get in the mom's bloodstream and make her adrenal gland release cortisol. So it's kind of cool. And as we've mentioned, yeah, it's just what I said. So what does that have? So what happens then? So here's a little puppy who's saying, I am ready to be born. So in response to that cortisol, the uterus will start to make estrogens and it'll start to make prostaglandins. And together, they're going to have certain effects. So the prostaglandin will destroy the corpus luteum, right? We no longer need it. It's time to be born. So that's going to remove this sort of the calming effect the corpus luteum and progesterone have on the uterus. The muscle layer, the myometrium, will now become sensitized to this other hormone called oxytocin, right? We're getting ready to be born. That's what this is. We're setting the stage for the uterus to start contracting and for that baby to get kicked out into the cold, harsh world. Okay, but all of these factors, of course, are going to lead to, a bouncing baby little piglet. It may not, I don't know, a turtle. I don't know much about turtles, or this cute little cria, or this really adorable little dog who's coming up in a moment. And my favorite part of all, you got to see this next part. After the dog's pretty cute, but wait till you see the next part. Here it comes. Oh my God. Little baby hedgehogs. Oh my gosh. That seems like it would hurt. Like it would hurt to give birth to a baby hedgehog. Are those real? That is just the cutest thing I've ever seen. Okay, and there's a lamb. Anyway, so right, that's what it's all about. Now, there are drugs. So what drugs are there? There are drugs that are similar to gonadotropin releasing hormone. And do you remember what that stands for? Right? What part of the body produces it? What hormones does it tell the pituitary gland to produce? Right, a little review here. So, right, it stands for gonadotropin releasing hormone, and the gonadotropins are luteinizing hormone and follicle stimulating hormone. So, if we give a patient a gonadorelin, it's like we're giving them gonadotropin releasing hormone. It'll make them release LH and FSH. FSH will make follicles get bigger, and LH will make a follicle ovulate. And in fact, we mostly use it for the LH effect. So here's what I mean. So cows in particular can get this disease called a cystic ovary. That's where this is actually a human female's uterus, but the parts are the same. So there's a normal ovary. Here's an ovary with this huge follicle. It's producing crazy amounts of estrogen. And so these cows are in a hypersexual state. They just have so much estrogen that they're in heat day after day. They should only be in heat for like 2 days. these cows, they'll be in heat for 2 weeks because this thing just won't ovulate. We can give them an injection of a gonadorelin. Again, it's like giving an injection of GnRH. Give it, it'll cause the adrenal gland to release FSH and luteinizing hormone. And by giving them the drug, it creates enough LH that usually, not always, but usually that cyst will ovulate. Sometimes we actually have to go in and pop it manually, if you can believe that. So, but I think that's maybe where this drug was first invented, right? It's got the name cystorelin. There's another trade name called Ovacyst. So I'm thinking that's why these were originally developed. But we found other uses for them. They can be used in what are called estrus synchronization. And so this would be the case if you had a whole bunch of cattle and you wanted to breed them all at the same time. You can use these different, this is one called co-sync, where they're using GnRH, they're using something called a CEDAR, we'll talk about later. They're using prostaglandin F2 alpha, we'll learn a little more about that. So they're using some of the drugs that you're gonna learn about, and you give some on day 0, and then you give some more on day 5, and then 3 days later you give another one and you breed her, and we're just kind of, again, we're kind of getting in the driver's seat to control when she ovulates. It's a lot more efficient than trying to catch 500 or 5,000 cows in heat. We're not going to talk about gonadotropins. There are some drugs, but they're just not used very much. So we're not going to talk about that. Okay, the next group of reproductive drugs are all based on progesterone, and they go by different titles: progestins, progestagens, progestational hormones. I don't know. I'm mostly going to either call them progestins or progestational drugs, but they are based on progesterone, right? Now, progesterone has a negative effect when progesterone's being produced by the corpus luteum. It has a negative effect on the release of gonadotropin releasing hormone and LH and FSH. So it's basically telling them to shut up. We're not going into heat. We are in diestrus, so shut up. We don't want any GnRH. We don't want any LH. There's no estrogen around here. Okay, so why would we use these? Well, one use would be to prevent an animal from coming into estrus, right? You could give it to this mare. If you're competing with this mare and she's about to come into heat, well, that might affect her ability to compete, right? If there's stallions around, she might be off her game. So, so you might use it on her. If you were planning on breeding her and you're waiting for the sperm to arrive or the stallion to arrive, you might use it on her because, horses are only in heat a few times a year. They're only in heat during the spring and summer. So you may want to, control when she comes into heat. And I hate Coors Light. I just want to say that. But every single one, I just think these pictures are amazing. But they all have a Coors Light barrel in them. That just drives me. I like Coors is okay. Just I hate light beer. Anyway, so I thought this might be helpful to tie this in to humans. So humans use progestins for contraception for the same reason, right? To prevent pregnancy. And so, like, for example, Depo-Provera is a progestin that's an injection once every 3 months. There are some oral contraceptives. Again, it's doing the same thing. It's going to prevent any sort of feedback from any sort of release of GnRH or LH and FSH. And that's going to prevent a new follicle from developing. So in mares, this is the drug you could use. It's called altrenogest or Regumate is easier to say. So Regumate, it'll do the same thing, right? So what are these progestins doing, right? They're making the females or the mares endocrine system think she's in the luteal phase, right? The endocrine system will think there's a corpus luteum making all this progesterone. There actually might not be a corpus luteum, but this is going to mimic the corpus luteum. And if you stop giving it, well, that mimics the lysis of the corpus luteum. And then a few days later, she'll go into heat again. The same product in cattle, there's a feed additive. So you could, if you needed to suppress estrus in a whole herd, you could do that using this melengestrol acetate. Again, if you have to breed all of these cattle, what's going to be easier, breeding breeding her, and then this one, and then that one, or you could time it so they're all going to get bred the same morning, and then they're all going to calve at the same time. So that's helpful too. There's a device called a CEDAR. It stands for Controlled Internal Drug Release, and it's this little kind of Y-shaped thing with this little tail on it. This part goes inside. You kind of collapse it, and it goes into her vagina, and she can urinate around it. But it's impregnated with progesterone, so it slowly releases progesterone. And this is used in like single animals. It's probably a little more exact than using that feed additive. And the CEDAR is the one that is mentioned here, right? They give the cow a shot of GnRH and they put in the CEDAR, and so that's going to make she's going to think that she's got a corpus luteum, and then you remove the CEDAR, and you well, anyway, we hopefully in discussion this week you'll talk about how this actually would work, because your goal is you're trying to make her ovulate and get her pregnant. Okay, now when do we not want to use these? Well, remember the effect progesterone has on the uterine lining. It's going to make it get ready for pregnancy. It's going to get kind of thick and juicy with lots of nutrients. That's great for a little fertilized oocyte. That's not great for bacteria. Well, it is great for bacteria. They like it too. It's just not good for your patient. So if there's any evidence of inflammation in the uterus, we cannot use it because we're going to cause an infection. If we use it for too long or at too high a dose, if we just kept progesterone going, for weeks and weeks, that could cause metritis, which means inflammation or infection of the uterus, or a pyometra, which is the same thing. It's just full of pus. Pyo means purulent. Progesterone can also interfere with the action of insulin, just like the glucocorticoid. So it can actually cause diabetes. And that's something that women will develop, called gestational diabetes. That happens in dogs and horses and cats too. And then finally, there's some concern if a woman is pregnant and handle this product, it could actually get absorbed into her and could risk her pregnancy. It could, instead of her being pregnant 9 months, it might prolong her pregnancy to 10 months. So, so pregnant women should not handle these progesterone-containing products. Estrogen, the hormone of getting pregnant or being in heat. This estrogen is kind of similar to testosterone. So these are anabolic steroids that can be used. And the main reason we use estrogen in dogs is to treat urinary incontinence. We see dogs that are spayed, so they don't have ovaries anymore. And as they get older, the sphincter muscles that tighten to control their bladder, they get kind of floppy. And these pets will wet their bed. When they're relaxed, urine will leak out. And so sometimes there's different things we can use to treat it, but sometimes we use a very, very, very small dose of estrogen, and that will, it kind of builds up muscle. It'll strengthen the muscle of their sphincter. And this is the product. It's estriol is the estrogen, and the name of the drug is Endocrine. And there's an ad where the person has covered their whole house with newspaper. Like the progesterones, but for different reasons, these can also predispose a uterus to infection. So we would not want to use it if there's any evidence of infection. At really high levels, these can actually be carcinogenic, causing things like mammary neoplasia. And for a while, I didn't complete the sentence. For a while, the older estrogen drug called diethylstilbestrol, for a while, nobody was using it because they were concerned about causing mammary neoplasia. And then they discovered, we can use it at a really, really low dose, and it won't cause those problems. The other thing that can happen is called aplastic anemia. And you learned last week in the antimicrobials, there's an antibiotic called chloramphenicol that can also cause aplastic anemia. And aplastic anemia means anemia, we usually think of meaning a reduction in red blood cells. Aplastic anemia means a reduction in every kind of blood cell. So white blood cells, red blood cells. I don't know why they don't just call it panleukopenia. Well, I guess they don't because it's red blood cells too. So it's all blood cells, and you can kind of see this bone marrow has like nothing going on there. So again, the risk is low, but we've got to be careful with estrogens. Another reproductive drug we can use is based on those prostaglandins. This is the chemical the uterus will make to destroy the corpus luteum, and that will begin the next heat cycle, right? It'll make progesterone levels drop. That will end diestrus, and then it'll allow luteinizing hormone and follicle stimulating hormone and to create a new follicle, which will make estrogen, and the whole thing starts again, right? So again, the follicle and estrogen, that's all taking place during proestrus and estrus. We can kind of ignore metestrus. We can just kind of consider that part of diestrus or estrus. Anyway, so in other words, the prostaglandins, they play a major role in synchronizing an estrus cycle, but this only works if there's a corpus luteum in it. There's no corpus luteum here. If you gave Lutalize here, it wouldn't do anything. But we'll talk about what happens if you give it here, where there's a corpus luteum. It'll suddenly end diestrus, and the female will move right into proestrus. For Megan Moses' cow, do you remember you guys came out and Mike Lewis bred her? Well, Megan and I had given her cow. I can't remember who was that Honey or was that Maddie? I'm kind of embarrassed. We went out and gave her 2 injections of Lutalize, and maybe did we all do it? Maybe we all did it one day. So we gave her 2 injections of Lutalize 10 days apart. And I'll talk more about that in a moment. The actual drug we use is called, the non-proprietary name is Dinoprost, but the proprietary name would be like Lutalize or Prostamate. And again, you get the name Lutalize. It's going to lyse the corpus luteum. A clever name. But there are some dangers with these drugs too. Again, I don't really understand why these could cause bronchoconstriction. It would be dangerous if you were pregnant, because if you were pregnant, it could lyse your corpus luteum and you could lose your pregnancy. So they say women who are pregnant, they say women of childbearing age just shouldn't even handle these drugs. And people with asthma should not handle these drugs either. But what it says there is, that's what the book says. Of course, what the bottle says is pregnant women asthmatics, or persons with bronchial problems should avoid contact. Okay, so now let's talk about some specific uses. We've talked a little bit about this. Um, again, we can use it to control estrus cycling, like we talked about all these cattle. It'd be nice to just breed them at the same time, then they'll calve at the same time. That facilitates, we can make sure we have enough people, enough facilities ready. We can use these drugs in some simple ways or complex ways, and I'll talk a little more about Megan Motz's cow. So again, cows cycle year round, estrus, diestrus, proestrus, right? Again, ignore metestrus, right? They go around and around, every 4 weeks, or this makes it look like, I guess it makes it look like 21 days. Okay, so every 21 days, she goes through her cycle. Okay, so Megan and I gave her cow these 2 injections of Lutalize, right? Again, she and I did it once, and I think we all did it once. So when we gave her that first injection of Lutalize, we didn't know where she was in the cycle, right? She could be in the follicular phase with a follicle. She could be in the luteal phase with a corpus luteum. We didn't know. Again, ignore metestrus. But here's what we did know. That 10 days after that injection, she was definitely going to have a CL. How did we know that? Well, here's how we knew it. If she did not have one on day 10, for example, let's say she was around here on day 0. If she did not have one on day 0, maybe she was here. Well, 10 days later, she was in here, right? 10 days later, she's in diestrus. She's got a corpus luteum. Or maybe she did have a corpus luteum on day 0. Maybe she was here, somewhere in here. We gave the prostaglandin, we lysed it, that moved her right over here. 10 days later, 3, 4, 5, 6, 7, look, she has a corpus luteum. Either way, 10 days after that first injection, she is going to have a corpus luteum. And so on day 10, we gave her the injection. What did I write here? Right, so just what I said. Okay, so if we give her that injection on day 10, which is what we did, that should lyse the corpus luteum, and then Megan had you all come out and Mike bred her, and it worked. She's pregnant, right? You could use a similar system with a mare, although I guess mares, their corpus luteums can be a little resistant to Lutalize. So we can also use drugs for foal heat. The book basically says they're still trying to find the best method. Foal heat is that first estrus that occurs after a mare foals, and it has kind of a disappointing conception rate. So I guess there's some value in trying to delay the foal heat. Like if you can delay it, then she'll have a better conception rate, but they're still trying to find the best method. Mares are seasonally polyestrous, right? They're only cycling during the spring and summer. That's so they get pregnant in the spring and summer. They have an 11-month gestation period so that they'll have their baby the next spring or summer. But during the fall and winter, they are in anestrus. There is no cycling going on. The ovaries are hibernating, basically. There's some action, but they're not going into heat. Anyway, to treat anestrus, I think is a way to get them to start cycling a little, to try to delay anestrus, because if you can get her pregnant in like, I guess it's not to delay anestrus, it's trying to get her to start cycling sooner, because if you can get her pregnant in February so that she foals in January, that's great, because the sooner they're born, the sooner you can register them. They might be bigger and stronger if they're showing. I would really need to probably ask Jordan or Taylor or someone or Lauren what they could add to this conversation, because I don't know anything about registering foals. Okay, but it sounds exciting. Okay, what else? We can use drugs to maintain pregnancy. Occasionally, we've had some farm animals that, you know, they just couldn't stay pregnant. They would have a they would lose the pregnancy. So we could use some sort of drug to help support the pregnancy, some sort of a progesterone drug. There are drugs that you could use to prevent pregnancy. There's this one in dogs and cats. It's not used very often, um, uh, but because it runs the risk of causing some uterine problems and mammary hyperplasia. And also, apparently, human athletes will get a hold of it and use it because it's an anabolic steroid. Isn't that great? Um, we don't usually terminate pregnancies too much. We do often sometimes have to try to induce parturition. But if a bull broke through a fence and bred a heifer who was really too young to be bred, we could just abort the pregnancy. If there was some sort of a deformed or dead, maybe I should say a dead fetus, they can get little mummified fetuses. Those are some reason we would use it. The book mentions if a mare had twins. Again, I don't. I'd have to ask those of you who know maybe more about horses. Um, I know that twins can lead to a lot of problems. Um, it seems like aborting twins would create problems too. But if she was ultrasounded and they were really, only a few uh, weeks old, I guess it wouldn't be a problem. We get questions from people whose their dog got bred and they'll want to abort the pregnancy. Luckily, it's amazing. Dogs actually don't get pregnant as easily as you would think. So a lot of times when dogs get bred, often they don't get pregnant, but it can be done using things like Lutalice. But it's not. It's a very unpleasant experience. I've never done it. I don't ever want to do it. So I've been lucky so far. So we use drugs like prostaglandin. Again, if it destroys the corpus luteum, that's the end of progesterone, and that will end the pregnancy. Um, the but its effectiveness will vary among species, and we'll use the cow as the example. So the cow's gestation period is about 9 months, and so her corpus luteum will last 9 months. But the cow is kind of weird because after about the fourth month, the uterus starts to make its own progesterone. It no longer needs the corpus luteum. So you can lyse the corpus luteum with Lutalice, but it won't affect the pregnancy. It won't terminate the pregnancy. So in other words, if for some reason this had to be used in a cow, it would need to be before 4 months. Again, because her uterus makes plenty of progesterone on its own. And then the last thing we'll mention here is in cattle, if we want to, in particular, if we want to, I've mostly used it when we wanted, like let's say we had a planned C-section on a really special cow. We could just let her calve on her own, but if we want to do a C-section, it's helpful to give her a shot of corticosteroids, right? These are what I should say, these really is the glucocorticoid cortisol. So we're actually mimicking that, how the fetus produces ACTH, and that causes cortisol to get released from the female and from the actual fetus. That's what we're doing. We're mimicking that release of cortisol that can cause the release of prostaglandins and cause the release of estrogen and things like that to help prepare for birth. And we can also use oxytocin. This would be during birth. We can use oxytocin if the uterus is really fatigued, but it's contraindicated if the fetus is not in the correct position. If the fetus were sideways or something like that, and you gave oxytocin, it's going to make the muscles of the myometrium contract. And if the fetus is in the right direction and the uterus is just tired, well, then it will help the delivery of the, well, the fetus, of the newborn. But if the newborn's not in the right position and you make the uterus, you know, bear down on it, that could just cause the uterus to rupture. So it's contraindicated. And the book talks about dopamine agonists and antagonists, and it makes no sense. So skip that. Okay, drugs of the endocrine system. That was the end. And there will be a third little Kahoot that you can try out. Okay, and let me know if you have any questions. Have fun in the discussion and contact me with any questions. All right, take care, everyone.